What if the push for vaccine mandates is hiding a deeper issue, one that hits hardest at race and class divides? Stay tuned, because today we're uncovering the truth about vaccine mandates, how they affect different communities, and why this topic is sparking heated debates across the world. Hey everyone, welcome back to the channel. And today we're tackling a big one: the truth about vaccine mandates, race, and class. This isn't just about getting a shot. It's about who gets access, who gets left behind, and how history and society shape it all. When I first heard about vaccine mandates, I thought they were just about public health. But the more I dug, the more I realized they're tied to deeper issues like fairness, trust, and inequality. In this video, we'll explore why some communities are more hesitant, how mandates can hit low-income and minority groups harder, and what we can learn from history to make things better. I've got real stories, surprising stats, and practical insights coming your way. So stick around until the end for a tip that'll make you rethink this whole debate. Vaccine mandates sound simple. Get the shot, or you can't do certain things like go to school, work, or restaurants. But they're not just about health. They're about who has power and who gets pushed out. In 2021, places like New York City rolled out rules barring unvaccinated people from gyms, concerts, and even jobs. Sounds fair, right? Protect everyone, stop the spread. But here's the thing. Not everyone has the same access to vaccines or trust in the system. For some, mandates feel like a choice. For others, they feel like a trap. I started wondering why some groups were saying no to vaccines more than others. It's not just about politics, it's about race, class, and a history of medical mistrust that runs deep. Let's start with history, because it sets the stage. Black Americans, for example, have a long history of being mistreated by the medical system. Ever heard of the Tuskegee experiment? From 1932 to 1972, the U.S. government studied syphilis in black men without telling them or treating them, even when medicine was available. Hundreds suffered or died. Or take Henrietta Lacks, whose cancer cells were used for research without her consent. These aren't just old stories. They shape how people view doctors today. When I read about this, it hit me. If my community was treated like that, would I trust the government telling me to get a shot? This history makes some folks, especially Black and Latino communities, question vaccines, not because they're against science, but because they've been burned before. Now, let's talk access. Vaccines might be free, but getting one isn't always easy. Imagine you're a single mom working 2 jobs in a low-income neighborhood. You don't have a car, the nearest clinic is an hour away, and you can't take time off without losing pay. That's reality for millions. In 2021, studies showed Black and Hispanic people faced more barriers to getting vaccinated, like lack of transportation or clinics in their neighborhoods. Meanwhile, wealthier areas had pop-up vaccine sites everywhere. I talked to a friend who said her cousin skipped the vaccine because she couldn't afford to miss work. Mandates don't account for these hurdles. They just say, get it or else. That can feel like punishment for being poor or marginalized. Here's a stat that stopped me in my tracks. In 2021, only 28% of Black Americans had gotten at least one COVID vaccine dose, compared to about 50% of white Americans. Why the gap? It's not just access. Mistrust plays a huge role, and it's not irrational. Black and Hispanic communities have been hit harder by COVID, higher death rates, more hospitalizations, yet they're less likely to get vaccinated. Some say it's because of myths like vaccines causing infertility, but that's only part of it. When you've seen your community used as test subjects like in Tuskegee, or forced into medical trials without consent, as historian Harriet Washington has documented, you're going to think twice about a new vaccine. Mandates can feel like another top-down order, ignoring these real concerns. Class is a big piece of this puzzle too. A post I saw on X pointed out that low-income and marginalized groups are hit hardest by mandates. Think about it. If you're a wealthy professional working from home, you can get vaccinated easily and keep your job. But if you're a waiter or a factory worker, refusing a vaccine might mean getting fired. In 2021, cities like New York mandated vaccines for public workers, and those who said no, often low-wage workers, lost their jobs. I read about a bus driver who refused the vaccine because he didn't trust it. He wasn't rich, didn't have a cushy office job, and now he's out of work. Mandates don't bend for your situation. They hit the working class hardest, and that's where race and class overlap. Some critics, like Boston's acting mayor Kim Janey in 2021, compared vaccine mandates to segregation. Harsh, right? But hear it out. If 75% of Black Americans were unvaccinated, as one report claimed, and mandates block them from restaurants, schools, or jobs, it starts to look like exclusion based on status. Janey even likened vaccine passes to slave papers. Ouch. On one hand, mandates aim to protect public health. On the other, they can push out people who already feel marginalized. I thought about my uncle, who's skeptical of vaccines because of past medical abuses. If he can't go to his favorite diner because of a mandate, how's that fair? It's not racial segregation in the old sense, but it can feel like a new kind of divide. Here's where it gets tricky. Some sources, like an article from The Conversation, say anti-vax movements are led by white, middle-class voices, not minorities. They point to history. In the 1800s, white anti-vaxxers used racial slurs to call vaccines savage or uncivilized. Today, some big anti-vax names make millions pushing distrust, often co-opting minority struggles to gain followers. Think about it. A wealthy influencer can refuse a vaccine and still live comfortably, but a low-income Black worker who refuses might lose their job. The irony? The same system that lets anti-vax leaders thrive doesn't protect the communities they claim to speak for. It's a power imbalance that's hard to ignore. Mandates often assume everyone's on the same playing field, but they're not. A 2021 study from the Commonwealth Fund said Black and Latino people aren't just refusing vaccines. They're often locked out of healthcare. Clinics might not have translators, or they're far from minority neighborhoods. Plus, health literacy varies. My cousin once told me he didn't get the vaccine because he couldn't understand the medical jargon on the forms. Mandates don't fix these gaps. They just punish people for them. If employers or schools require vaccines, they should offer paid time off, on-site clinics, or clear info in multiple languages. Without that, mandates hit the most vulnerable hardest. Misinformation doesn't help. In 2025, myths about vaccines, like claims they cause autism in Black kids, are still floating around, despite being debunked. A retracted 2004 study falsely linked the MMR vaccine to autism in Black boys, and it's still cited by anti-vax groups. Social media, like posts during Robert F. Kennedy Jr.'s Senate hearings, spread these ideas fast. I saw a post on X claiming vaccines were a government experiment, and it had thousands of likes. But scientists say race isn't a biological factor for vaccine safety. Those myths just fuel fear. The real issue? People trust these myths when they don't trust the system. So how we fix this? Mandates alone won't cut it. Dr. Rhea Boyd, a pediatrician, said in 2021 that instead of forcing vaccines, we need to make healthcare accessible. That means mobile clinics in underserved areas, free transportation, and doctors who look like the communities they serve. When I volunteered at a community center, I saw how much people trusted local nurses who spoke their language and knew their struggles. Education matters too. Clear, honest info about vaccines, not just take it or else. If we want more people vaccinated, we gotta meet them where they are, not push them out. If this video opened your eyes, hit that like button. It helps spread the word. Drop a comment. What's your take on vaccine mandates? Have you seen these issues in your community? Subscribe for more videos that break down big topics like this. And check out the video linked on screen about healthcare myths you need to know. See you next time.